Because when I talk to leaders across the country and elsewhere about, what's the problem in healthcare? It's not just about individuals being resilient and strong. They already are. We need to figure out how to improve the conditions of work. And most of it is by being a good leader.
How can a set of skills lead you down the path to success? That's what we're setting out to answer on the EdUp Canada podcast. I'm your host, Michael Sangster. Join me as we unpack how leaders around the world have taken training and skills and turned that into a lasting career. Now let's learn together. Welcome back to the EdUp Canada podcast. I'm Michael Sangster, your host, and I am joined today by not a long-standing friend, not someone I've known for years, but somebody I have just met, spotted her new book on LinkedIn, and someone else has written something about it that caught my attention. I thought, this is interesting. We come together here and we talk about education all the time and the need to keep training the workforce we need. My guest today, Raelynn Douglas, has written a book, The $1 Billion Blind Spot. I love the front cover. Objects in mirror are costlier than they appear. The hidden cost of turnover in healthcare. So as I said earlier, we talk about education a lot, the need to train workforce. I'm interested in a conversation today about what's going on in the workforce. So do you want to go ahead and introduce yourself and what you're doing now, where you're living?
Sure, Michael. So great to join you here today. I'm in Regina, Saskatchewan.
We're off to a good start. We're off with the good people.
Absolutely. But I lived in Ontario for 10 years, really got to know the healthcare system there. I'm currently the CEO of Rae Soleil Consulting, and my husband and I have developed an app called My Life Catcher, which is also a fun way to help people who are juggling many demands in life. And my most recent exploration was writing The $1 Billion Blind Spot, which is a passion of mine. The healthcare system is in dire need of support. So I brought together my finance and HR background with an MBA in health and life sciences to really hone in on what I think is the most strategic investment we can make is in the healthcare workforce.
You talk about in the book that it's not about turnover as more than a human resource issue, but it's really a massive financial leak. What do you mean by that? Let's jump right in.
Yeah, so we've been talking about this healthcare human resource crisis for many years. I was studying it in my MBA before the pandemic. And so everyone thinks it's an HR problem. We have a shortage of workers. My premise is that absolutely not. It's a retention problem. We've got many, many people working in the healthcare system, not at full capacity necessarily, part-time roles. We've got great opportunities. We're hiring. So I don't think it's a recruitment problem. I think it's a retention problem. And when I talk to leaders, I ask them, what is your turnover rate? Most of them don't know it, or they think it's within industry standards, or it looks good on paper. Any departure from healthcare is a significant loss, and no one is calculating it. No one's paying attention to it. So it's been invisible to many, many leaders. And so my job in the book is to bring those two voices together, HR and finance, so to speak the same language and to understand that anyone leaving the healthcare system causes a huge financial drain.
One of the things that we talk about a lot is the retraining, the upskilling, the giving people a career path beyond their current role. You touch on that a little bit as well.
Yeah, I think that's an awesome retention strategy. People are looking to be passionate, gainfully employed, pursuing things that add value and meaning to their lives. If you can offer them an opportunity for career pathing and additional, leadership development, it's a wonderful way to have someone stay committed and, loyal to your organization for the long term.
Let's sink our roots in and make sure we understand the challenge. Before we get into the retention, the other issues that you write about, let's talk about the challenge now. We do have a massive health workforce challenge in this country that needs to be dealt with. That's step one, right?
Mm-hmm. Yeah. And I think it's not just this country. Everyone around the globe is experiencing this, especially since COVID. So, as I watch this across Canada, we'll focus on Canada, many organizations are offering signing bonuses. We're attracting people out to hospitals away from long-term care, and we're recruiting from the Philippines and other countries. So I think we're doing a lot of effort on recruitment, but I'm not hearing those retention strategies, beyond wishful thinking or visionary statements of, improving the workforce. I want to see tangible retention strategies that say, we are investing in the well-being. We're moving beyond individual resilience programs to really think about the conditions of work. What is the leadership skills? How do we create conditions where people love to work, they want to stay, and they want to grow their career?
It's not just about $1 an hour more, is it?
No. In fact, when you talk to most healthcare leaders, as long as their pay is competitive, they're not concerned. They're looking for opportunities to obviously pay the bills, but to really have rewarding work where they feel that their values are consistent with what's being offered in the workplace, efforts to reduce violence, to improve mental health. People are just looking for great leaders to work for and opportunities to grow. Those are the things that really matter too. What I'm told in the nursing and the physicians, allied health across all sectors and occupations.
What I took from the book, interestingly enough, was this is about healthcare. This could be about other sectors. A lot of the things that you're talking about, how to keep people in a role, stay interviews jumped out at me, some of the different things that you're talking about here. So let's dive in a little bit about what you've discovered or what you've seen around mental health in the workforce. I know personally, this is a topic that before COVID, my friends didn't talk about, but now we do. And I don't know if it was COVID or we all slowed down or what it was, but I'm interested in what you've seen through your research, your writings around the importance of mental health in the workforce.
Yes, absolutely. And I read a lot of stories in the book. So one of them is my own personal story about burnout and having 3 young children and really, struggling at work. I had a panic attack. But that was 20 years ago, 25 years ago. We didn't talk about mental health leave. We didn't talk about stress leave. It was get back to work and keep performing. Now, I think we're a little bit more open to having the conversations about what do you need. But we've also got greater demands on us. There's way more people offering caregiving supports to elderly parents, juggling that sandwich generation. So I think, the problem has become deeper and more pervasive. And I think, there's a bit more comfort in talking about it. But what are the actual supports we're providing? I'm a strong advocate in flexibility and autonomy, allowing people to have choice in their hours of work, their places of work. That's not a common feeling yet. I think we're moving towards it. Australia's just, had some success with a 4-day work week. So I think, it's up to all of us to think about how can we improve the conditions where people are spending the majority of their time. And if they're feeling better at work, they're better at home and vice versa. So I think, we have to turn from a negative spiral of stress and burnout to something that offers opportunity and optimism and career pathing.
I'm a bit of a strange duck. I'm trying to get to a 5-day work week. Down from 6, but I love work. But it talks about it in the book a bit, but it is about what each individual's needs are too, right? I enjoy 2 or 3 hours on a Saturday afternoon, plunking through my emails, doing a few things. I'm weird. But you got to find that balance amongst your team too, right? And balancing the whole structure of your organization.
Well, I wouldn't say you're weird. I'd say you're fortunate. You found work that you love. And so being at work fulfills you. And not all of us have that feeling yet. Or, if you're working for someone who really respects and admires and listens to you, you can have more of that rewarding feeling. But if you're dragging yourself to work you have the Sunday scaries and you're experiencing that anxiety, you're not going to want to work 5 or 6 days a week.
I like the flow of the book, from awareness to checking in, to check your blind spots, to leadership mastery. I'm kind of intrigued of your check the blind spots section of the book. I really enjoyed chunking through that and seeing some of the things that you talked about, but especially this presence, communications, and language. Mm. This is something I fail at a lot, is getting the language right, getting the temperament right on a day-to-day basis. So any advice here, any thoughts here that come out of your own work?
Well, I suspect you don't fail at it. I suspect you just have a very high standard for communications, which is different. And so I think, you're obviously in the education space, your leadership development, you're interested in having people improve their communication skills. So taking a step back to answer your question, when I first started out with my consulting company, I thought resilience, people need to take care of themselves. They need to set boundaries. They need to drink water, move their bodies, eat nutritionally. So I designed a resilience course that I offer online. And then during COVID, there was a resistance to the word resilience because I think people assumed we were saying, well, just yoga your way back to being, superwoman so you can take it all. And so now there's a shift to actually, it's the organizational resilience. What are we doing for the conditions of work so that people can have well-being and a full-time job? And so what I did in the book here was to say, hey, we've got this massive opportunity. If we stop leaking people, we have more money to invest. Then let's, make sure everyone's healthy and we have well-being and resilience as a priority. But then what are all the tools we can employ as leaders to be clearer in our communications, to be present, compassionate, empathetic, to communicate clearly, to offer flexibility. So the second half or 2/3 of the book is really the tools for leaders to become more present, more engaging, more compassionate. And then I think about, some of those skills that go even further that I've called leadership mastery, which is performance measurement, evaluation, ROI. And so I don't know if you've gotten far enough into the book yet, Michael, but I use an F1 analogy because I've become a huge fan of Formula One and Toto Wolff and the work that he's doing with his organization on well-being. Because we know that every person working in that pit crew or in that engineering team has data that they need to share. And if they don't feel safe, that they can share or offer insights, then the whole team suffers. So what if we applied that kind of thinking to healthcare, where everyone is contributing, they're offering their best selves, working to the maximum scope of practice? That's, I think, the kind of leadership mastery we need in healthcare. So I'm excited to help be part of the solution to train leaders to be those kinds of leaders.
So let's get back to the problem at hand. I'd like to get a little bit more from you on the leakage, the $1 billion blind spot of just how bad you believe the problem is.
So I like to tell a fun story. Say you're taking a trip, you're going to the mountains and your kids are in the car and they're on their phones and they're watching movies. And after a month, you get your cell phone bill and it's $10,000. You'd be, what? You'd take the phones away. You would call the phone provider. You would immediately make sure you understand data plans and all of that stuff. You would do something about it if it was your personal finances. But at work, we're like, oh, we're $10,000 over budget. Oops, submit, right? And so now I was reading about some of the hospitals in Ontario that are turning to lines of credit and bank loans because they can no longer get money from the Ministry of Health. They can't overspend. And so we've got this disconnect in how we budget our own personal finances and our finances at work. So that's the number one problem. I don't think people fully appreciate it. And then when we talk about the cost of turnover, first you need to understand the cost of replacement. So they say, it's 1.5 to 2 times salary to replace a senior leader, $75,000 for a nurse. What is the number? When I did my research, I worked with the Work Institute that said, even if you use $15,000 per employee, that's a low conservative number, but let's just use that number. So this organization I was working with had 5,000 staff, 30% turnover, that's 1,500 people. Times $15,000, that's $22.5 million. Every year leaking out of their budget because it's, Indeed costs here, it's time and interviews there, it's, like reputational risk, all these things go into the cost of replacement that just is scattered across line items and no one's calculating it. So when you think about that, every organization having this leak that no one's paying attention to, multiplied across organizations, across sectors, it's a massive problem that no one is paying attention to. So Gallup calls it the $1 trillion preventable problem. And I've said, okay, well, for healthcare, it's got to be $1 billion plus for Canadian healthcare. So if we can stop that leak, call the cell phone provider. Don't lose that money. Instead, invest it in retention strategies. Then we'd have our system operating more effectively. We'd have more money for post-secondary education, for highways. These are all taxpayers' dollars. It's not like we have a money machine, right? It's coming out of our pockets.
We train a large number of personal support workers in this country in career colleges that I represent. And one of the things that's constantly talked about is the high turnover, and it's blamed on mental health, workload, hours, salary, and they go to find other opportunities. And I believe those are actually the factors from the conversations I generally have with people out there in the marketplace. But we're not entirely certain. But I think there's a lot in your book for leaders to learn about how to lead their organizations to assist in lowering that number for sure. I was really intrigued to watch. It was Kean College in Newfoundland that was building a program around medical office assistants, I believe, but it was to people who work in the healthcare system. And they actually scheduled all of the practicums, the work life experiences that our colleges operate under, to be in the summer. And almost all of them were scheduled that way, no matter when they started in the program. And I asked one of the members of the college, why were you doing that? It was about vacation schedules for the current employees, building in a workforce replacement to give people a break and a breather and a chance to take a holiday the time of year when they want to. So I thought that was a really interesting little policy, little change that could be done to make a difference.
I love those little policy changes. I've proposed many of those through my career. Not all of them have been accepted. PSW turnover, I would like to share an example with you, Michael. So years ago, when I was working in Ontario, we were looking for a new program to come in before COVID to offer virtual care. And the idea was it would be a combination of a nurse and a PSW supporting at the bedside. So it'd be a blended rate, which was financially affordable. But the reason they brought that in was because of a nurse shortage. They couldn't support the population, in this rural area of Ontario. So the reason was, a workforce problem. They had a shortage and they had a high turnover. But once they implemented this new program, not only did they have nurses staying on longer because they could stay at home and they could delegate responsibilities to many personal support workers, but even more importantly, I think the personal support workers loved it because they were part of a program. They had a team. There was greater communication. They felt valued. They felt supported. They got skilled up a little bit. So that made me think, PSWs are the workforce of the future. If we can
train enough of them.
Well, and if we can give them opportunities to learn and grow and have that team-based care, incredible workforce and eager to learn.
We just made the exact point of the book. I'm thinking about how many can we train. You're talking about how do we keep them, give them more of a future and give them a career path, which is one of the things that we talk about in our training. So if we were to focus in on this PSW issue and continuing care aid, there's so many different names for it across the country. It's only in Canada would we have the same job with 9 different names based on what province you work in. If you were to build some skill sets in to our personal support worker program, I'm interested. What would you think are the most important skills that we should be building in that would make PSWs successful?
Well, before I talk about skilling them up, because I think they're already super skilled, my first step would be to offer them full-time employment, because a lot of them get hired and they get trained, but then their hours drop because of, funding mechanisms or market share or whatever. So we need to keep them full-time. The reason I mention that as number one priority is we're competing with Tim Hortons and retail and jobs that don't offer long-term pathways necessarily, but they're offering full-time wages. So if we could say, you have a full-time job and you've got opportunities to grow. There's many people I met in my circle in Ontario that started out as a personal support worker or a physiotherapist or whatever and became CEOs of organizations. There is a wonderful pathway. And so then if you started offering leadership skills, communication, presence, dealing with empathy so you understand your patients a little bit better, how can we allow them to have really exciting, rewarding work where they feel valued, where they could see the difference in the patients they're serving? Man, I think that's the ticket.
And we have a lot of courses around gentle persuasion and palliative care and other issues, but we also many of our colleges will add financial literacy courses. So not only can they get to work, they can help manage the budgets around the operation as they move up as PSWs, but also making sure they take care of their own finances.
Really
and set
good.
themselves up for a solid future in this country. Many of them are newcomers to Canada and need that opportunity. So
yeah,
the upskilling too, we got to find better pathways, how to get a PSW into a nursing role, into bridging people up into those bigger opportunities. I loved your story about the online program with the PSW at the bedside and the nurse somewhere else and handling more patients. I think that's a great story. What's the best kind of program you've seen or best institution? Maybe that's unfair, for employee retention in healthcare. Or a great leader with a great story?
Well, I think right now we're struggling with scarcity of time, right? No matter who you are, you don't have time to take a course, right? I had the ability to leave my job for a while and pursue an MBA. That is a huge luxury right now. People don't do it. So I think micro-credentialing, things that are offered asynchronously, plus have an opportunity to engage with the leader. You want to offer things that meet people quickly, effectively, inexpensively, right? Because no one really has the time or the resources to invest in training. So the best model, I would say, is micro-credentialing. And, you mentioned earlier, how do we get PSWs to become nurses? I would challenge your thinking a little bit on that, Michael, and say, maybe they don't need to become nurses. Maybe we need super PSWs, right? That have all of these skills, because doctors are delegating on to nurses who are delegating on to personal support workers. We obviously have an administration function. We have a navigation issue. What can personal support workers do more clinically, but also to help connect and engage and notify, have some more skills that are delegated from nurses? But maybe it's a short program that they can upskill. I was just at a conference in Edmonton and I got to meet two amazing nursing leaders from Red Deer Polytech. And they hadn't seen each other for a while. And I was witnessing them talk about, okay, we need a program that's really short, that fits between, and I'm sorry, I'm going to get the letters wrong, but LPN and RPN, because that's what our nurses need right now. And I love to see the light bulb go off and the energy between these two senior leaders to say, how do we design that program? And how do we get that out the door ASAP? So that's the kind of energy and excitement that I think we need, not just for nursing, but in the personal support world as well. I think that's the job of the future.
I agree with you. And I like your language. I like the use of your language. Give people the path they want to take. Give them multiple pathways to go do a little bit, do a lot. I look at our early childhood assistant program that our colleges teach, which also gives an opportunity to bridge into being an early childhood educator. But that individual might want to go work for a couple of years and build up some skills. They also might financially need to. So why not let them become an early childhood assistant, go make money, get the kids a little bit further along in their development of raised at home, and then jump them into an EC program if they want. So I'm with you. Multiple pathways, skills development. We work with different partners that help our students also add a little skill here, a little skill there. I can't agree with you anymore. Before we run out of time, what's your great big message? Because I'm going to ask you a couple of questions we ask every guest at the end. But from the book, what's your great big message?
Well, I think there's a huge opportunity, right? Everyone thinks that this is a financial problem, and it has become a financial problem. Like post-secondary education and everyone else is suffering because healthcare is eating everyone's lunch. Well, if we fix healthcare by retaining staff, and we're hiring, so let's bring people in from retail and hospitality and tech and everywhere. There's thousands of jobs. Let's give high school students an opportunity to become a lab tech, So let's feed the system with people, but don't treat them as transactional and temporary. They are people you've invested in. I like to say, if retention is your number one strategy, every conversation you hold, every policy you write, every conversation you have is different because you're building a long-term relationship. And so there are examples of companies who do that, who say, okay, we're going into a downtime, but we're not going to let our people go because we're just going to have to rehire them. And how expensive is that? So if we can figure out this problem, then we don't actually have an underfunding issue. We've got a retention issue. And that is a huge untapped market of people who are just wanting to work in healthy, compassionate workplaces with leaders who respect them. It doesn't cost anything.
Talk to me, before we get to my other questions, talk to me about one thing that jumped out at me. Stay interviews. I think this is something every one of us is thinking about doing, but nobody ever gets to.
Well, we're all scarce for time, right? And so, if you ask somebody, are you doing exit interviews? They'll be, I don't know. Are we? It's too late. Have the conversations with people because you want to offer them opportunities for growth. You really care what's going on with them at home, right? Like, I was dealing with my dad was palliative last year, and I wasn't showing up at work the way I wanted to be. I was burning out and stressed and really worried about him. So maybe if somebody had said, do you need a little bit of time? We'll pick up the slack. And I did this for my leaders to say, hey, you're going through a tough time with your dad right now, but next month it might be someone else's daughter. So we all lean in and we help one another when we need it. And guess what? That pays back big time in loyalty because people are looking for flexibility.
I can't agree more. And it's one of those things that you got to just get it in your calendar and get it done. because you're going to get as much out of it as the team member is too, I bet, most of the time, because you share a little bit about yourself while you're there. Gives you a chance to take a bit of a breather. So we focus on a couple of things here. Every part of the education system is about mentoring, whether you're at a university, a career college, community college, whether you're in a big classroom or a little classroom like our institutions, or you're in a practical training solution like our PSW program is 700 hours. And 300 of that is in a care home learning with people, or in a home learning hands-on with people. Talk to me, Raelynn. Mentor in your life, changed your path, whether it was in the healthcare system or where it was. Is there somebody that had that impact on you that you think there's a lesson there for others?
Oh, do you always mention a specific name?
Well, you don't have to say the name, but the individual, just that path. Everybody's got, it's funny, the more we do this, the more I think of new ones. I always say but just somebody that had an impact on you, because we're encouraging others, do the same thing. Take a moment.
I love it. It's a fantastic question. I have several mentors. My dad was a big one, and I had a number in the healthcare system. But I want to share one with you that I had a chance to reconnect with recently, because I live back in Regina now. And he was my executive director for a number of years in the Ministry of Finance. And just a really great communicator, practical. But what I really loved, and the idea I want to share with you today, is this idea of rethinking things, not being bound by the norms. And so one day I took my car into the shop, and they told me your brakes are busted. And I came back to work and I said, "Oh, Brass, I'm really worried about driving home. My brakes don't work." He said, "Well, don't use your brakes." I thought, well, okay, of course, right? And that's the kind of thinking he applied to everything we did. Yeah. And I had to tell him that, I really appreciated that new way of looking at things, right? There's a way to drive home without using your brakes. I just want to share that as an inspiration for people to rethink the healthcare system. It's not necessarily lack of money. How can we be creative and attract people to this workforce? If they said it's 14% unemployment, youth unemployment in Ontario right now. Let's make the connections. Let's train them up.
I think what I took out of the book, one of the main ones is empowerment. It's just empowering people to do the job and feel like they're leaders and they can do more and they can step up. And that's what a lot of it comes back to. So your own career. We have students that listen. We have instructors that listen. What is a skill that you have that has made you successful? And did you have it or do you develop it? I often say, I can pretty much walk into a room. If there's a microphone, I'm comfortable. Not afraid to talk to people. That has helped me be successful in ways. So I'm wondering if, for yourself, is there something that you think has been crucial for you?
I've had to keep learning my whole career. I went back to school and, to get my MBA in my 50s. I was terrified of public speaking. So I had to work on that with Toastmasters and practice. But I think, the one skill that kind of allowed me to grow was that curiosity and that willingness to take on change. I've changed a lot in my career, my personal life, and where I've lived. I think it's that openness that change can be exciting, that it's not something to fear.
Great message. I'm going to give you a chance to wrap us up here in a second, but I purposely didn't get into the last section. I think that people have to read the book, buy the book to talk about the tricks that you put in here.
Thank you.
And you can only cover so much in half an hour, but is there a message that you want to deliver before I tell people how to find you?
Oh, that's such a great question. It's so open. I think, I would love this book to start conversations, to really get at the conditions of work. Because when I talk to leaders across the country and elsewhere about, what's the problem in healthcare, it's not just about individuals being resilient and strong. They already are. We need to figure out how to improve the conditions of work. And most of it is by being a good leader, making eye contact, saying thank you, being open to change. And that doesn't cost anything, but it does take time, and it does take some interest in being that kind of leader.
I still think the biggest one for me is just the ability to admit when you make a mistake. If you want to ask everybody else to put their hand up when they do, you got to put your hand up too if you make a mistake and say, okay, let's regroup here. I got this wrong.
Yeah.
And
have you
really
seen
important.
That happen in many of your workplaces, Michael?
I have. I've been very lucky in the cultures that I've worked in. I worked in one that was very difficult and didn't view it that way. I worked in others. I remember putting my hand up one time when I worked as an executive at TELUS, and I got something wrong. I put my hand up. We went in a room. We closed the door. We figured it out. My boss gave me a good blast, rightfully so. But the moment the doors opened up, we left that room and no one ever heard about it again, and we moved on with our lives. So you got to be able to be transparent yourself when you get something wrong. I try to be. You got to be a little bit vulnerable. It's a challenge, and I think we need to, your book challenges some of those things. So before we sign off here, let me just give you a chance here. Raelynn, how do our listeners find your book?
Well, it's on Amazon. So if you search $1 Billion Blind Spot, you can also go to my website, raesoleil.com, RaeSoleil. We're doing a nurse retention forum in June. So there's a bit of information about that. Read a little bit more about the book. And yeah, it's available on Amazon.
I really enjoyed this. Thank you for taking a leap of faith and joining me. We've never met each other. And I reached out on LinkedIn, having seen the book, and thought this would be a different way of looking at education and making sure that our educators think about some of the skills that they build into their training to help people be successful when they get into the roles, instead of just focusing on how many more we can get trained to get into the workforce. Although we need to do that, we need to look at retention. We need to look at the entire healthcare system to make sure we're meeting our needs for the future. So I appreciate you joining us today, and I look forward to some point maybe at Taylor Field. There's no F1 races in Regina these days, but there's definitely a great football team, and maybe we'll be able to get together and have a cup of coffee or a cold beer at a football game someday.
I would really like that, Michael. Thank you so much, and I appreciate you reaching out to me.
I look forward to seeing you again in the future. And with that, we will wrap up this week's edition of the Ed Up Canada podcast and look forward to presenting you with another episode next week. Thanks for listening. Thanks for listening to another episode of the Ed Up Canada podcast. We release new episodes regularly, so make sure you hit that subscribe button so you know when they are officially out. If you love this episode, please leave a 4 or 5-star review wherever you listen to your podcasts so that others can also discover how a set of skills can lead to success. Thanks for learning with us.